ventricle is the strongest one because it has to pump it to the veins, to the lungs.
Hey, when you do this, you should expose the bicuspid valve. Okay, it has one big posterior cusp, and the anterior cusp you should have cut. Half of it should be over here and half of it over here. This is the big posterior cusp. You can see the tendinous cords. You may have cut some of them to get the chamber open. Papillary ridges again, the tendinous cords. Notice that the left atrial chamber, the back wall is very smooth. But if you do look at the front wall, you will see some of those pectinate ridges, although they're not as prominent as they were in the right atrium.
There we go.
Okay? This time you want to run your fingers around this left atria, looking for openings, and where your fingers come out of the left atria.
Say it right.
That's the entrance point for the pulmonary veins, bringing the blood back to the left atria from the lungs. Again, it should be two separate openings. If it's cut down low, the pulmonary veins will all be one opening. That's the entrance point for the pulmonary veins coming back to the left atria.
Okay.
Yeah, my hand is cold.
This is a good time to mention that these dissected hearts will be on the lab exam. We typically use the instructor's dissections, not yours. You're going to throw yours all away once you've studied it because they're usually so bad that I would never use them on the lab exam. Okay? But I will keep every heart that I cut all week, which will be 4 or 6 of them by the end of the week. And that's what will go on the lab exam is some instructor's hearts, dissected hearts, okay? You're not going to have a review session to look at these again. So make sure you're very comfortable identifying all the structures on the dissection list before you dispose of this heart. And I just want to say that, you know, this might be sitting like this with a pin in it, and it'll say, what's this structure? That's the left auricle flap. What's this? That's the left ventricular wall. Or it might be propped open and say, what's this space here? This is the left atrial chamber. What's this structure here? That's the bicuspid valve. Okay? So while you have this open, and you found those pulmonary vein entrances, I just want to show you that sometimes we'll just put a probe through like this, and we'll say, what is the probe exiting in? And you have to know that that's the pulmonary vein opening because it's coming out of the left atrium. Okay? The other thing that you have to find, and this is probably the most difficult thing to locate, is if you haven't cut these tendinous cords from this posterior bicuspid valve cusp, you need to cut them now, cut the tendinous cords, put your probe up under that posterior cusp, and if you probe around with your probe there, you should be going through the aortic semilunar valve and push your probe all the way up, and the top of the heart here, it should come up and to the aorta. So this cut vessel here behind the pulmonary trunk, this is the pulmonary trunk that we cut. This cut vessel behind it, this big large one, is the aorta. And that's the only way we find the aortic semilunar valve. Once you have it, you can tip it up and look in there and see the 3 valve cusps. But that's how it's always marked on the exam, is with a probe going through it. We use the probe.
We didn't really. I mean, ours is already.
The valve cusp is in here.
Where's that?
Valve cusp. I don't know if I can turn my light up.
This one, no, that's the
See where my probe's going through?
See
See the whitest 3 rounds of whitest tissue around my probe? Those are the aortic semilunar valve cusps.
Yeah.
kind of in the middle to me.
And your probe should come right up out into the aorta.
Oh yeah. It's like the biggest.
So we've done the 4 valves, the 4 chambers, the great vessels, pulmonary trunk, pulmonary veins, superior and inferior vena cava. And we've done the grooves on the front and the back, and the apex and the base. Those are the main things that you have to know on the dissected heart. I am telling you, you almost always will get 1 chamber, 1 valve, 1 vessel on every lab exam, and then usually some landmark, like apex or base, or right coronary sulcus, or anterior ventricular.
Okay, so this is this one.
Don't, listen to me now. when you go back through the list on your lab manual and repoint everything out, and you're done with this heart, you're going to put it in the red autoclave bag at the sink where you disposed of blood waste last week. Put any disgusting paper towels that have blood like this in the paper bag also, okay? And then you're going to clean your dissecting pan and tools with soapy water and dry it, and put it back on the table for the students to put a new heart in for the next lab. Then you're going to get a clean paper towel and the orange Zep cleaner or the Clorox bottle at the sink. Spray it on your desktop and wipe your desktop down. Okay? Okay, and you're going to keep your safety glasses on until everybody's work area is cleaned up and all the hearts are disposed. So don't take your safety glasses off when you're done working. Don't take them off until I tell you that everybody is done working. Okay, then you can get books signed and return to model study, but you're going to be doing it with your safety glasses on. You can take your gloves off when you're done your work, but don't take your safety glasses off until I tell you.
Oh my, I never put
You can never take your safety
Okay, so it's yours is already open your book.
Okay, so this is
Yeah.
what?
Yeah.
I should probably put those glasses on.
Right? And like Oracle, right? Oracle.
You're welcome to look at this heart. Just don't make any cuts on it or pull it apart excessively. Okay? You're welcome to look at it before I put it away.